This video is for educational purposes and demonstrates a standard of work on our labor and delivery unit during a CAT team. The scenarios are representative and may not reflect exact real-life situations. Actual responses may vary based on patients' needs, team dynamics, and available resources. Nurses should rely on their clinical judgment, training, and collaboration with the care team to ensure safe and effective care.
Hey Jordan, it's me. Hey. So baby's not liking this position, so let's try to turn to the other side and see if the heart rate will come up, okay? And move this. Okay. Get baby on better. Right now, let's try to turn to the other side. Okay. Yeah, he's still not making this. Let's go to this other side again. I'm gonna actually call for some extra help, okay?
Okay.
So Sarah.
Call LND Resource Nurse 1.
Hi, Sadie.
Hey Carolina, I'm having some D cells in 4. Can you come help me?
Yes, of course, I'll be right there.
Thanks. Oh, let's put this SpO2 on your finger. There you go. There you go.
Hi, Jordan. This is Carolina.
Hi. So I've changed her positions a few times. I've stopped the pit, but baby's still having some significant variables.
Okay, so I'm just gonna help over here.
Okay.
Can I put your head down?
Alright.
And we're gonna change the position again, okay?
Okay.
Let me call Dr. Vandermotor. Hold here, Vandermotor. Jordan, we're gonna be changing your position, okay?
Okay.
Here, Van Remorter. Is this correct?
Yes. Let's put you a little more to the side.
Okay.
Okay, so the pitocin is off.
Here, Van
And
Remorter.
we're giving IV bolus.
Yes.
Okay, and then she has a 3-weight on.
Yes.
Okay, great.
3-way is on.
We're gonna be doing an exam.
Hey,
Okay.
Carolina.
Hey, Dr. Vandermotor, we are in room 4 for D cells. Can you come to the room?
Sure, I'll be right there.
Thank you. Okay. Let me call for some turb just in case
Yeah.
we need it.
So Sarah.
Call Samantha Iron.
Samantha Iyer.
Hi, it's Dr. Van Morter. Hey, Dr. V. So we've been having some D cells for the past
Hey,
5
Samantha, are you able to
contractions.
bring me some turb to room 4?
Yes, okay.
I've stopped the pit and I've started an
Thank you.
IV fluid bolus.
Okay. Okay. And you guys have tried position changes and
Yes.
everything like that. Okay. And I just heard Carolina calling for some terbutaline, which I think is a good idea. So when the terbutaline comes in, we can give it.
So she's been having some variable D cells down into the 70s for the past 5 contractions.
Okay.
We've tried different positions. I've stopped her pit and I started fluid bolus.
Okay. Great. Hey Jordan, how are you feeling?
I'm okay.
Okay. So it sounds like the baby's having some dips in the heart rate with the contractions, which is pretty common. But we do want to make sure that we get them to go away. And we're going to probably give you a medication called terbutaline that goes under the skin. It helps to decrease how strong and how frequent the contractions are.
Okay.
It will probably make your heart race. That's a normal side effect. It lasts for about 30 minutes to an hour.
Okay.
It may also make the baby's heart rate a little bit higher, which is fine too.
Alright.
Are you feeling these contractions very painfully, or what are you feeling right now?
My epidural's working pretty good.
Okay, great.
Yeah.
Okay, good.
Dr. Van Morter, I have terbutaline. Would you like me to give it?
Yes, please, let's give it.
Okay.
Okay, well, I think after you get the terbutaline, it might be a good time to do an exam to see how dilated you are, because I think we have to question a little bit. Sometimes when you're more dilated, that will also cause some drops in the heart rate. Any clinical changes since, like any bleeding?
No bleeding.
Okay, any rupture of membranes recently?
No, she's been ruptured for 18 hours with
Okay.
neck.
Okay, so, yeah, let's see, we'll get the terbutaline, I'll get the glove and just get ready to.
I have one ready
do
for
the
you.
exam. Oh, perfect.
I'm just gonna give the techs a heads up in case we need them.
Okay.
One of the resource nurses.
Hi.
Okay.
Okay.
We're here all here to help.
Thank you.
All right, Jordan, do you feel like you're ready for an exam to see
Yeah.
how dilated you are?
Yeah.
Okay, all right. Turbis given, can you?
Yep.
Yeah, thank you. And we'll see,
All right.
I'm just waiting to see
Turbs
if it,
in.
if it blocks out the contractions a
you.
little bit.
Okay.
Okay, so while we're waiting to see that, I'll do the exam and
Okay.
then hopefully those contractions will slow down.
Okay. All right, let me help.
So Jordan, I did the exam, and you're about the same, like 4 centimeters.
Okay.
So it doesn't seem like the reason for the variables for these decelerations is because the head's coming down a lot yet.
So I noticed the heart rate's been down for a couple minutes now in the 70s.
Okay,
Going
so
in here.
yeah, so I think the terbutaline didn't kind of get rid of the contractions enough, and baby's feeling kind of stressed right now. So I think that we should go back to the operating room.
Okay.
There's a chance that we would need to do a C-section, like we talked about before. But we'll check what the heart rate is when we get back there. So the whole team's
Okay.
gonna come in.
Okay.
We should call a CAT team.
Okay, I'll call a CAT team.
Have you had surgery on the abdomen before?
No.
Okay, so this will be really fast.
Urgent broadcast to CAT team.
Low. Risk of bleeding, possibly blood transfusion, very unlikely. There's a small risk of infection.
CAT team, LD4 to OR.
There's a risk of
CAT
infection.
team, LD4 to OR.
There's a small chance
CAT
of
team,
infection.
LD4 to OR.
Infection. There's a risk of injury to organs around the uterus, so things like the bowel, the bladder, nerve vessels, the uterus.
Lots of people are gonna come in the room, we're gonna be moving really quickly now, okay? Looks like you're in good hands.
Thank you.
All right, are we connected to the IV pump right now?
No, I'm just gonna take the
Okay,
bag off.
and then we need to make sure to bring, you guys disconnected the epidural already?
Yes.
Okay. Okay, great. And this is in, bed's up. I think we're ready to
Alright,
go.
ready to go, careful of your step.
Pass, okay?
And moving the cords.
Thank you.
There we go.
Okay.
Hi guys, my name's Chris. I'm the anesthesiologist. Dr. Vandermoor, can you
Yeah.
tell me the S-bar, please?
Yeah, so this is Jordan's just term. She's having a bradycardia. We're moving to the OR. She has an epidural that has been working for her.
So my name's Chris. We're going to take really good care of you. I'm going to give you some stronger medication through your epidural here. And we're going to take some to go in there and get you all cleaned up. And we're going to start doing some tests to make sure this epidural is working like we expected.
C, ORC. In time, 9:46. I guess I'll just head to bed and who wants to do, head to bed, who's the name for me? I'll call them.
Can you keep the noise level down, please?
I'll take the bed out.
Jason, do you want to count?
Okay, let's count.
Male, male.
1, 2, 3, 4. Call ALA. 2.
What are we, guys, what are we seeing on the monitor? Looks like it's heart pulse in the 70s. Okay, so we're gonna need to go quickly, guys.
Anything other than pressure? No. We are good to prep.
Okay, we're not gonna prep because the heart rate's still down, so let's just get the booby pad on and, okay, all right, I'm gonna go scrub. All right, I'm gonna pass off the booby here for the suction.
Alrighty. How would you like your settings to be? 40-40.
Here. Okay, great. All right,
Section is 5.
great. Okay, ready to start.
Take a moment to look at the CAT team roles when in the OR. Ideally, each role remains in their designated area while prepping the patient for the C-section. Notice that the primary nurse is positioned toward the foot of the bed. This allows the primary nurse to write on the whiteboard, use the CAT team clipboard, S-bar to the NICU team, and count with the OB techs. The resource nurse on the patient's right will be able to assist with left tilt if requested, apply the Bovie pad, apply SCDs, and connect the suction. The left resource nurse will assess the fetal heart tones, start an IV, assist anesthesia, perform abdominal prep if needed, secure their leg strap, and most importantly, communicate with the patient. The charge nurse will assist with the removal of the labor bed and provide needs outside of the room, like updating the family, designating tasks, communicating with blood bank, X-ray, and IR as needed. We hope that staying within these designated areas will help promote efficient care and ensure the safety of our patients.
Can we do a timeout?
Yes, Jordan, we're gonna be doing a timeout to make sure everyone's on the same page for the surgery. Everyone's gonna just be listening now.
Okay.
So this is Jordan Doe, date of birth 8/20/1992. She is 41 weeks and 4 days. She's having a C-section for fetal deceleration. She has no known allergies. She got her ANSA and her physical license.
Yes.
Okay, she's got her SCDs on. Is the machine on?
Yes.
Yes. Okay, instruments have been
Yes.
counted
Yes.
and sterile?
Yes.
Okay, and the ALS team is here?
NICU team is here.
Okay, we're ready to start.
Jordan, where's your beautiful baby? Here you go. I'm gonna just adjust the drape and you can kind of hold her.
Would you like to do a sign out? Yeah. This is Jordan Doe, date of birth taken her.
2 liters of crystalloid, 400 a urine, which is clear.
Okay, and the QBL, we have the QBL listed. We've got 200 there, and then we've got 800 on the board, so we'll say 1,000. Okay, all right, thanks. Great. Sadie, I'm just thinking that after the case, we should have a debrief just to go over things into the CAT team. Okay, so let's get a team together and talk about it afterwards. Okay.
In some cases, a patient may not have an epidural in place during a CAT team. If there isn't enough time to safely administer a spinal anesthetic, the anesthesia team will proceed with general anesthesia.
All right, testing. Can you feel anything, Jordan?
Yes.
Okay, she's not comfortable.
Yeah, we're gonna go ahead and do this under general. I'm gonna start pre-oxygenating. Dr. Jesus, please drop some medications.
Okay, you let me know as soon as you're ready.
We're gonna give you some oxygen here, and we're gonna start dropping some medications, all right? All right, you let me know when we're ready to induce.
Okay, we're ready for you to go ahead and do
Great,
something.
we are inducing. Okay, inducing. All right, so please. Airways in and secured, you can go.
In conclusion, this video serves as a valuable learning tool to illustrate the coordinated efforts and best practices of our labor and delivery team during a CAT team response. While the scenarios presented are educational and not exact replications of every clinical situation, they highlight the importance of critical thinking, teamwork, and adaptability. Above all, patient safety and quality care depend on nurses using sound clinical judgment, following their training, and working collaboratively with the entire care team.